Hey everyone, Ashok here from Dynamic Health Professionals, sharing some thoughts on what is naturopathic medicine. Now, this is a question that comes up often when people hear the term naturopathic doctor, but it even comes up for people that know what a naturopathic doctor is or have seen an ND in office. Not everybody is fully aware of everything naturopathic medicine entails. So, naturopathic medicine, it's a form of medical care that has been around for over 100 years at the very least. But it saw itself diminish and almost completely fade away in the early 20th century. The last 3, 4, maybe 5 decades, however, have seen a tremendous growth in the profession, mainly due to a huge push from people demanding safe, cost-effective, preventative, natural, holistic medicine that treats patients as individuals and not just a diagnosis or a disease. A quote from the official website of the AANP, the American Association of Naturopathic Physicians, says that naturopathic medicine is a distinct primary health care profession emphasizing prevention, treatment, and optimal health through the use of therapeutic methods and substances that encourage an individual's inherent self-healing process. The practice of naturopathic medicine includes modern and traditional, scientific, and empirical methods. Now, that's a pretty good explanation. But what really makes naturopathic medicine different and distinct as a system of medicine? Well, basically, naturopathic medicine is based on 6 main principles and a therapeutic order that guides the level and force of intervention that should be used to affect a patient's health. So let's start with the principles. First is the healing power of nature, or vis medicatrix naturae. Naturopathic medicine acknowledges that there exists an inherent self-healing process in all living organisms that is both ordered and intelligent. The goal of the naturopathic physician is to recognize this and to remove obstacles that are preventing this natural process from occurring in the patient, but also to augment this force and allow it to function optimally. The second principle would be identify and treat the cause, or tolle causum. Now, there is a cause for all illness and disease in the body, and the naturopathic physician basically endeavors to find that cause and treat that. We believe that treating anything that is the result of the cause, or which is a reaction in the body, is symptomatic treatment, and it doesn't really heal the patient. You're just putting a Band-Aid on it. This leads to the third principle, which is treat the whole person. Treat the whole person, tolle totum. Along with treating the cause, the physician must recognize that the body is a whole. It's made up of physical, mental, social, emotional, environmental, genetic, and spiritual aspects, maybe more. Therefore, medical practices must attempt to link these aspects together in a person and treat them as a whole and not just separately as individual pieces of the body. The next principle is first do no harm, primum non nocere. So naturopathic physicians follow basic guidelines to ensure that they're not harming their patients with their treatments. This includes abiding by that therapeutic order that I mentioned earlier. Basically, we start at the lowest force of intervention possible and then move to higher force interventions when necessary. Now, this avoids harmful suppression of symptoms, and it also respects the natural healing process of the person, and it doesn't override it. Now, the next one, which is my personal favorite, is doctor as teacher, or docere. This principle revolves around the role that physicians play in their patients' lives as educators of health. Naturopathic physicians must educate their patients, encourage self-responsibility for health, working to empower the individual with the desire to heal themselves. Without educating a patient and allowing them to learn how to heal themselves, we don't really fully help the patient through their health care. That is part of the naturopathic belief. The final principle, which is a pretty big one as well, is prevention. The prevention of disease by assessing risk factors for patients, their susceptibility to disease, genetic factors, etc. That's at the core of naturopathic medicine. If we can prevent illness, medicine becomes focused on optimizing health instead of fighting disease. So that is the 6 principles. But the next thing that I mentioned is the therapeutic order. Basically, the base of the therapeutic order is establishing the conditions for health. This happens by addressing basic determinants of health and identifying and removing disturbing factors, kind of like treating the cause in the patient. Basically, you establish a patient's individual healthy diet and lifestyle, ensure that they have fresh air and exercise and healthy social interactions and personal practices in their life. And this leads into the next step, which is stimulating the vis, which is that first principle of naturopathic medicine. By stimulating the vis medicatrix natura, you're supporting the body's inherent ability to heal itself, and that often takes care of most of what you need to do. But if that doesn't, the next step would be tonifying weakened systems. So this can be done through homeopathy, acupuncture, hydrotherapy, or exercise, or more. Basically, you work at a very low force intervention to help tonify any systems that need help. Next comes correcting structural integrity. This could include naturopathic manipulative techniques, exercise, corrective therapies, whatever. But beyond addressing all of this, the next step involves addressing pathology, but using natural substances. These substances can include supplements, herbs, nutraceuticals, homeopathy, or even certain foods as medicine. After this point, when the pathology is still too strong, this is when you address the pathology using pharmaceutical or synthetic substances, and prescription medicines are brought on board to overcome a strong pathology. Finally, if none of this works, the final step is either suppress symptoms and suppress disease and improve quality of health, or remove the pathology through surgery. So it's important to understand that all aspects of medicine, whether it be conventional, naturopathic, alternative, or otherwise, have their place in healthcare. So sometimes surgery is part of that, and that's acknowledged by NDs. And this is often an overlooked point, saying that naturopathic doctors are anti-conventional medicine. That's absolutely not true. Naturopathic physicians like to have a place for each part of medicine to play its role, but not to overtreat a patient. So the scope of naturopathic doctors is quite wide, but it varies by regional regulations. And because of such a large scope, the training actually looks somewhat similar to conventional medicine, especially in regards to basic sciences and basic anatomy, physiology, whatever science training. Naturopathic Medical School is actually also a 4-year accredited program. It has both basic sciences and clinical board exams, and entry, and clinical entry and clinical exit exams as well. So at its widest scope, naturopathic diagnostic and therapeutic modalities will include clinical and laboratory diagnostic testing, nutritional medicine, botanical medicine, naturopathic physical medicine, which includes manipulation techniques, hydrotherapy, myofascial techniques, more hands-on techniques, but also public health measures, hygiene and counseling, minor surgery, homeopathy, acupuncture, prescription medications, intravenous and injection therapy, and naturopathic obstetrics, or natural childbirth, or midwifery. So with the training involved and the scope of practice, it's easy to see why naturopathic physicians are becoming more and more sought after in North America and across the world. So outside of being primary care doctors, there are many NDs that also specialize in certain field of medicine, or an area of medicine, kind of like their specialty. And these will include cardiology, physical medicine, injury and pain management, urology, men's health, women's health, pediatrics, geriatrics, naturopathic oncology, gastroenterology and digestive health, environmental medicine and therapeutic detoxification, counseling, biofeedback and mind-body medicine, neurological and behavioral medicine, dermatology, and the list goes on. So it's great that there's so many new integrative practices that are being more available now, that revolve around having MDs, DOs, DCs, NNDs, and other medical providers collaborate on patients and work together. And this really is the best medicine that a patient can get. Having a holistic approach and every expert kind of doing their role, which is great to see this trend towards a more natural, holistic, and alternative to the conventional approach. Which reminds me of a quote that's often accredited to Thomas Edison. And it goes, "The doctor of the future will give no medicine, but will instruct his patient in the care of the human frame, in diet, and in the cause and prevention of disease." And that, I think, sums up what naturopathic physicians do quite nicely. So that's all. I hope this brief explanation of what naturopathic medicine is and what naturopathic doctors do has been useful. And if it does pique anyone's interest out there, feel free to look up more information at naturopathic.org, which is the official website of the AANP, the American Association of Naturopathic Physicians, or continue to follow our content here at dynamichealthprofessionals.com. Thanks.